Good morning, everybody. Can I thank the thousands of people who've come forward to get tested this week, and especially yesterday overnight. Dr. Chant advises me that in southwest Sydney we had over 3,000 people come forward for testing yesterday. And can I thank the nearly 24,500 people that got tested yesterday in New South Wales. Overnight we had 8 cases, 2 of whom were in quarantine, 6 of whom were in community transmission, and Dr. Chant will outline details of that. And since 8 p.m. last night, we also had 5 additional cases, which I'll ask Dr. Chant to explain or to demonstrate the circumstances of. Can I please say to all citizens of New South Wales, we've said this every day for the last fortnight, we are in a state of high alert. We need to make sure we contain this virus. We need to make sure we get on top of any potential hotspots or any potential community transmission that might be bubbling away under the surface. All of us need to limit our activity. All of us need to think about what we are doing. All of us need to think about how we're keeping ourselves safe, our family safe, and our loved ones safe. So whilst we are encouraged by the number of people coming forward and getting tested, whilst we're encouraged by the great detective work our health officials are doing, we remain in a state of high alert. We remain concerned about the underlying community transmission that could be bubbling away, and in response, we ask all of our citizens to think carefully about their activity. We're not suggesting that people completely isolate themselves unless they have symptoms or have been tested or have to, but we're certainly saying to people in the next little while, think about what you're doing, think about where you're going to make sure you keep everybody safe. I do also want to especially thank Dr. Chant and her team, the Health Minister, and everybody in health. The detective work that's gone on this week has been nothing short of Herculean. With the one Crossroads outbreak, we've seen anywhere between 5,000 and 6,000 people contacted and their contacts contacted. It's been a major job, and I'm incredibly proud of all of the team. And I want to express the deepest gratitude on behalf of all of our citizens to everybody involved in that effort. Many of those health detectives have been on the task for months and months, and this week in particular, we just saw how exceptional their abilities and their vigilance is in keeping all of us safe. We also know from Dr. Chant and our health experts that indoor activities are the greatest threat in spreading the disease. And earlier this week, the New South Wales government announced some tightening of restrictions around pubs. Today, I'm announcing further tightening of restrictions. This is to give us every opportunity to keep New South Wales as open as possible, every opportunity for New South Wales to keep moving forward. But we say this in the context that we have to be flexible. We have to appreciate that once this disease gets into the community, it moves very, very quickly and in ways in which we can't always predict. So therefore, what we need to do in New South Wales is minimise the risk of those activities which we know super spread the virus, those activities indoors which we know act as a catalyst. And this will also take pressure off our health authorities if there is an outbreak in a particular venue or a particular area in the number of people they actually need to contact trace as a result of that. So I'll be announcing today that from Friday next week, although we hope that people will take on this advice from today, but we're giving businesses the next few days to get themselves organised, that the restrictions we'd imposed on pubs will extend now to clubs, to restaurants, to cafes and all indoor hospitality venues. So whatever restrictions we announced last week, and the most important one I think for the majority of our citizens is no group bookings above 10 people. Now the reason for this is we absolutely need everybody seated when they're in a venue. No mingling. And when you have smaller groups, there's less chance of people getting up and mingling. We do not want any sort of mingling that spreads the disease. And group bookings of any description in any hospitality area have to be restricted to 10 people. And that's really important, in addition to all the other measures we'd announce in relation to pubs and hotels on Monday. For weddings and corporate events, the maximum number is 150. But again, completely seated, no dancing, no singing, no mingling. 150 maximum. And please know that whether it's a cafe, a restaurant, a club, a pub or a wedding, everybody everybody indoors is subjected to the 4 square metre rule. So if you have a smaller space, you might only be allowed to have 20 people in your space. The 4 square metre rule has to be applied strictly, as does the 1.5 metre social distancing. So the numbers we talk about are caps, and they relate to the larger venues, but for many venues across the state, the number of people they can have in their venue will be far less than what we're advocating. Now, for funerals and places of worship, and we appreciate that this is a very difficult consideration for many families and communities, but for funerals and places of worship, we're limiting that to 100. And the reason we are doing that is because for funerals and places of worship, people tend to know everybody else at that event or at that ceremony, and that increases the risk of transmission. There are emotional occasions where people know each other, and that increases the risk of transmission. So for funerals and places of worship, we are limiting those numbers to 100. But again, the 4 square metre rule applies. If your place of worship is smaller, you have to be subjected to less numbers. And similarly for funerals and where they're held, they're all subject to the 4 square metre rule. So the numbers we're giving you are the absolute maximums. They're not what will affect or what in fact will be the average. Now, in relation to who you welcome into your home, the health orders currently say you're allowed to have 20 people. We are not changing that, although I do want to stress that in the next little while, Dr. Chant and her team have recommended that 10 is a safe number. As I said, we're not going to change the 20 at this stage, but in the next little while, we ask people to be thoughtful about who they welcome, how many they welcome, and especially protect those most vulnerable. Again, we're not going to change the number for outdoor gatherings of 20, whether it's training together or being outdoors, because we know the threat of spreading the virus outdoors is less. It's still there, but it's less than the threat of spreading the virus indoors. Now, these measures that we're bringing in are to protect New South Wales, to reduce the risk, because we have to assume, based on what's happening in Victoria and based on the numbers that we're seeing in New South Wales and based on the great detective work our health officials are doing, we have to assume there's a level of community transmission, and these measures will reduce the risk of that community transmission getting out of control. But what is most important is for people with symptoms to go and get tested and stay home. If someone has contacted you and said stay home for 14 days, you must stay home for 14 days, because you might test negative on day 3, but you might test positive on day 6. So the reason you have to stay home is because the virus can be in you and not actually be detected until far later in that 14-day period, and that's why it's so important for everybody to stay home during that period. But our general message to everybody in New South Wales is that we're doing okay, but we're on high alert. We're very concerned. We're worried about any seeding that may have happened from Victoria even a month or so ago that has been bubbling along beneath the surface. And we also have a couple of cases that still have unknown sources, which Dr. Chant will talk about, and that worries us. They could be linked to the current cluster or they could be new clusters, and that's why we have to be on high alert. But I'm incredibly, deeply grateful to all of our health experts, our police, our Service New South Wales staff, all of whom in the community have been working their guts out this week to keep us all safe. And I'm incredibly proud of each and every one of them, and I thank them all on behalf of the 8 million citizens of New South Wales. But I also want to thank, in particular, the Deputy Premier John Barilaro, the Treasurer Don Perrottet, and Victor Dominello, Customer Service Minister. These 3 have made sure that we've contacted industry, spoken to business already. So what I'm announcing today is of no surprise to these industries. It's of no surprise to key organisations that we've contacted to explain to them the context of what we're doing and why we're doing it. This is all about keeping New South Wales open. This is all about making sure we allow people to have their livelihoods, to keep moving forward, but also, importantly, to reduce the risk. The health experts have told us what the high-risk areas are, and we're responding to that. And I think it's sensible and prudent and the best way forward. So I'll now ask Dr. Chant to give us her update. Then the Deputy Premier will talk about the restrictions and in particular their impact on the regions. And then Minister Dominello will talk about compliance, which is so important. You heard us even before we realised how bad the situation in Victoria was. that compliance would be stepped up this month. Well, now we're redoubling our efforts in relation to compliance. And I want to thank Minister Dominello's team of regulators, but also the New South Wales Police Force for supporting our efforts and stepping up in that regard. Dr. Chant.
Thank you, Premier. 8 new cases of COVID-19 were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases to 3,346. We had a total of 24,467 tests that were notified in the 24-hour reporting period. There's currently 101 COVID cases being treated by New South Wales Health, with 1 in intensive care. That person is not requiring a ventilator. So the new cases reported many of these have been reported in the press previously, because for public health reasons we've been going out promptly when we had information that's important to inform the public. But just to recap, those cases were 2 in-return travellers in hotel quarantine, a woman in her 20s from northern New South Wales who returned from Victoria, a woman in her 20s from Hunter, New England, who's a partner of a known case, a woman in her 30s from southwestern Sydney who worked at the Thai Rock restaurant in Stockland Mall, Wetherill Park, on the 9th, 10th, 11th, 12th and 14th of July, and a man in his 80s who dined at the Crossroads Hotel on the 5th of July, and 2 cases linked to the cluster who did not attend the hotel, a child and a teenager. From 8 p.m. last night to 9 a.m. this morning, an additional 5 cases have been reported, including 3 linked to the hotel cluster, but who did not attend the hotel, 2 men and 1 woman, all in their 20s, and 2 members of the same household, a man in his 40s and a teenager, who are under investigation. So the total number of cases linked to the cluster are 42, and this includes 14 who attended the hotel on the 3rd of July, 1 who attended on the 5th of July, and 27 who are linked to the cluster but did not attend the hotel. So they are contacts arising from it. And I'd just like to point out that there's often been 2 to 4 chains of transmission that we've picked up in this period since the 3rd of July. And I think this highlights the rapidity and the speed with which this virus can move through the community. But what is pleasing is that some of these cases have been diagnosed whilst they've been isolating. And this really highlights the importance of the isolation message. So when our public health officials ask you to isolate, there is a reason. It means that many of these cases have not been out and about whilst infectious, and therefore the chain of transmission has effectively been broken. New South Wales Health is tracing a large number of people even currently associated with these cases. There are 5 recent cases that report spending some time in the Stockland Mall at Wetherill Park while infectious. So we're urging anyone who was at the mall in the last 2 weeks to be particularly vigilant for symptoms, and especially those who attended the Thai Rock restaurant on the 9th, 10th, 11th, 12th or 14th of July, to watch carefully for symptoms, and if they occur, isolate and immediately come forward for testing. It is imperative that people, whilst we've got a strong focus on the Crossroads cluster and the activities in southwestern Sydney, it's important that we are not complacent about the risk existing in other parts of the state. It is imperative that anyone across the state comes forward for testing if they have the symptoms, however mild. And in relation to many of these venues in southwestern Sydney, we're urging people to come forward even if they don't have symptoms for testing, if they've been at the specific sites we've identified. And the reason for that is that in talking to the younger people, we notice that their symptoms are often very mild and they don't perceive them. There might be a mild headache or a mild fatigue, a slight fever, but for them, they're not recognising all them as symptoms. So that's the reason in those settings where we are trying to detect any possible cases and do that public health contact tracing around them, we are urging the community to come forward. The testing sites in southwestern Sydney will remain open. So thank you very much to the community for coming out in such high numbers, and can I extend my gratitude to you, but urge you to continue to represent. So anyone who has symptoms, please present, and anyone who's been at those venues we've identified, please present. Thank you.
Today's announcement in tightening of measures to operate a business in this state and doubling down on the compliance on those businesses is a partnership between, of course, the government, businesses, industries and sectors. It is about a little bit of short-term pain for a long-term gain. We don't want to lock down sectors, industries or businesses. We do not want to lock down the economy, but we do need to put in place those measures that allow us to operate safely. There is a burden on businesses in this state to do the right thing, to become compliance safe, to be COVID safe, and to be, of course, following the protocols. But to the individuals in this state, there is personal responsibility. And can I just say thank you to the New South Wales citizens for the success that we've seen is because people are doing the right thing. The vast majority are doing the right thing. But this is a real threat. And it's a threat that we need to be ahead of the curve on. And that is why in New South Wales we've taken the position of being cautious early so that we can avoid some longer restrictions being removed. For Regional Rural New South Wales, right throughout the pandemic, I've stood side by side with the Premier and Metro that we are all in this together. And the truth is that the threat for Regional Rural New South Wales, because of the Victorian border, is real. And that is of concern. As we've opened up travel within the regions, which is fantastic for regional tourism, the threat becomes live and well. And that is why these announcements today apply right across the state. There is no division between regional, rural or metro. We're doing this because it's the right thing to do to protect our citizens, but at the same time allowing businesses to operate. And if we do it together, what we can do is make sure that this state continues to deal with the health pandemic, the safety of our citizens, more importantly, making sure businesses can continue to operate and continue the economy going, because we know how important that is for the livelihoods, the mental and health being of all our citizens.
Well, we want businesses to be part of the solution, not part of the problem. And quite frankly, if businesses do not take public health concerns seriously, then seriously they should not be in business. And today's announcement takes us another step forward in that journey. We are calling out on the good businesses to keep up the great work that they are doing, and overwhelmingly we have great businesses around the state keeping the economy going, doing the right thing in terms of public health. But there are always going to be those businesses that think that they live beyond the law. Well, today's announcement says no, you must now comply with the law. I'm asking the businesses in today's announcement that you must do a couple of things immediately. Download your safety plan, register that safety plan, and then make sure that you comply with that safety plan, including digital attendance records, including keeping the COVID-safe hygiene measures in place. We want businesses to survive, indeed thrive, but it can only be done in a COVID-safe way. Thank you.
Premier, could you explain why is there the difference between weddings and funerals, the 150 versus 100?
Because the evidence we've received, and certainly the health advice, is that funerals are extremely emotional time, and whilst people are complying whilst they're seated, in between that service and other parts of the service, we're identifying too much mingling amongst people because everybody's known to each other in very emotional circumstances. Well, that's a different circumstance because they're seated the whole duration of the event, whereas at funerals, depending on the religion and the ceremonies, there are different aspects to the service. Part of the service is seated, part of it might be at a burial place. So funerals are much more complex in how people interact with each other, whereas weddings, our expectation is everybody comes down, sits down and stays seated. That's why no dancing, and unfortunately people will have to make decisions as to whether this means they wait or whether they proceed on the existing restrictions. But this is to keep people safe. We know how the virus spreads. We know what the high-risk activities are. We know from overseas experience what the high-risk activities are. And this is all about reducing risk. I would much rather be in this situation now where we reduce the risk rather than have this disease take hold in an uncontrolled way throughout the state and then cause us to go even harder, which is absolutely what we want to avoid. And I just want to really thank everybody for coming forward and getting tested. It's been absolutely brilliant. The thousands of people who've got tested, who've come forward, has allowed our health experts to do the detective work they need to do to contact trace, and just appreciate, and this is why we've put a cap on those larger venues, appreciate that from one hotel having to contact trace all those people, the resources it takes, and then their contacts, and as Dr. Chant said, a number of people now who've been identified with the disease are contacts of people who went to the Crossroads, not direct people who went there. So it's a good example, a good case study of how quickly and how widely the disease can spread, and it's a good wake-up call for all of us, because I feel that there was too much complacency in the community. All of us thought the worst is behind us, life is back to normal. Well, unfortunately, it's not. Life is not back to normal until there's a vaccine or cure. We don't know when that is, but what we do know is until that time, we have to mitigate the risk. We have to reduce the risk of those activities which we know more quickly spread the virus.
Have we, notwithstanding the fact that it is a higher risk activity at a funeral, have we got any examples of the virus transmitting at a funeral or cases that have come from a funeral?
Oh, there are plenty overseas, but Dr. Chant, do you want to talk about that?
We've had actually quite tight restrictions in place for funerals for quite a period of time. They were limited to, I think, 20 initially, then went up to 50. And then we were in a situation where we didn't have much local disease. And so the risk associated with funerals was actually very low. We do know that religious events have been associated with transmission, and that's been reported internationally. We're aware that we've had transmission associated with religious services in New South Wales, and we've certainly had transmission associated with a wedding. But it also is a context. For a period of time, we had very minimal, very limited community transmission, and so the opportunity for seeding of a particular event, and that in fact allowed us to be open up and ease the restrictions. But I think this is a wake-up call where we're in a particular risk period. We know we've had introductions of the virus throughout the state. We've seen how it can amplify quite quickly in the context of southwestern Sydney outbreak. But what concerns me is, do we have clusters anywhere else that are currently undetected? So for us, this next 2-week period is a critical one, and it's a time when we need the community, businesses, and government to work together to adjust those settings so that it keeps us safe.
Deputy Premier, you've mentioned how important tourism is to regional communities, but a lot of these areas are now cleared or recovered from COVID. Is the government considering limiting Sydney-siders travel to the country? We know Barilaro has already themselves rejected it.
Yeah, well, what we're doing today is restrictions and protocols and measures in place to protect everyone in New South Wales. We want to see travel within the state, and we welcome it. But we've also got to do it in a safe way. And in one way, today's announcements by saying these are the restrictions that we're putting in place for a period of time is actually sending a message to businesses and individuals that there's some certainty going forward. So you can plan your trips away, but you're going to have to do it in a way that, of course, meets all the safety standards. And if you're a business operator, we want you to operate in a COVID-safe way. At this stage, no, but we're seeing what's happening in Albury and the Albury-Wodonga community. That is a border community. It's a joint community. People in Albury will travel to Wagga. People in Wagga will travel to the ski field. They'll come into Sydney and vice versa. So this isn't just now a threat of Sydney-siders to the regions. It actually can be the other way around, so that's why the measures are applicable to everybody.
Is it going to be okay for fans to keep going to sporting events, for instance, because it's outdoors?
Yeah, well, the Premier mentioned earlier that the risk profile has been because of indoor venues, and that has been what we've identified through pubs, clubs, restaurants, cafes, and then those other events that what would you call human behaviour changes. And at this stage, we understand that the risk is less. Not that it's not there, but it's less in outdoor events like going to the footy or going to the local park with a group of 20 with your family.
Just with the clubs, the large clubs, some of them would have multiple rooms or kitchens. Is it 300 per room per 4 square metres, or is it a 300 cap on the venue? Because obviously a lot of them can take thousands.
Yeah, so we're working with the clubs, but it's 300 per venue. But if you've got multiple rooms and it's in a COVID-safe way, you can have it per dining area. But again, it's got to be in strict compliance with the health orders that provides a number of measures in relation to going in, making sure there's no mingling, and ensuring that there's sufficient evidence of COVID-safe marshals around. The point is, as the Premier has already said and Kerry Chant said numerous times, we've got to stop the mingling. So it's not about quantum, it's about making sure that people stay apart in a COVID-safe way.
Dr. Chant, do we have any numbers on the amount of people that are coming into New South Wales from Victoria under the exemptions that are in place right now? And also with contact tracing for those people under exemptions, how do we trace if there's any transmission with them?
So we are following up some groups within that, and we're working cooperatively with Service New South Wales. So we probably could give you the data after the this press conference from Service New South Wales. There are some follow-up of some elements of those, depending on what permit system there are. And certainly there's even been some strengthening and changes to the permit system structure to obtain more information, which will allow us to audit it. But clearly our principal advice is we really want to reduce to the minimum the number of people that are coming from particularly the hotspots area, but Victoria overall. We do obviously need to have some exceptions for critical services or for people that are seeking healthcare that can only be provided in some of the facilities in New South Wales, because we have to, that is the right thing to do. But we do want to send a strong message that we do not want people to be abusing the permit system, and we are going to be trying to strengthen the permit system so it reduces to the absolute minimum to those critical workers that we need to keep the system going.
Cases, are they connected to the cluster in Crossroads? Or
so what we've noticed is that there are some people, of the cases, you can imagine that when we interview cases when they're infectious, they go to shopping centres. It's not unusual. But what we're saying now is we've found that there have been 5 of the cases whilst infectious at Stockland Mall, so hence we are just calling that out. And also in relation to the Thai restaurant, we do think a transmission event occurred there. I also want to say that it's really important that community does not penalise the businesses that we name. I just want to thank those businesses for, doing the deep clean. And once the infectious person is removed from that premise, those premises are actually been undergoing more vigilance from health authorities than any other business. So I just want to ensure that people are, once we have given the businesses the all clear, that people should feel safe in returning to those businesses, because we do not want to discourage people coming forward for testing. And if the community is punitive against those businesses, it does provide a barrier for any staff or owners to come forward for testing. So if we can just please understand, once those businesses reopen after the deep clean and infectious people having no longer attended, they're probably one of the safest venues to go to.
Go-kart track in Wollongong between the current health list, the owner there is very unhappy apparently that he wasn't informed about this. I presume that there's communication to these.
My advice, and I've just been briefed very quickly before coming in here, and I'd be happy to follow that up. My advice is that they were advised. I'd have to look at the timing of that, but I also believe that there were some environmental health officers who went to the track. But rather than prosecuting that, I'm happy that our health team will reach out to that go-kart operator, and if there's any learnings in how we communicate. But our process will be to reach out, provide the advice and support the business wherever possible.
I know that you addressed the use of CCTV. There is a section of the Privacy Act that allows for the use of CCTV in health risk issues or areas. Is that not sufficient for the health department?
We'll use CCTV in a circumstance where it's useful. So we've used, it's not that we haven't used CCTV, so it's really on a case-by-case basis where we think it will add and enhance and narrow down our risk messages. In settings where we don't think it will, then it's not our utmost priority. So we're open to looking at all forms of technology. As I said, we're using the COVID Safe app. We're using, we're very pleased that sometimes we'll even get the whole list of gym membership in a particular club and send out the message quite widely. So we'll use a variety of different methods, and we're opening to using CCTV when we think it will enhance or tailor our message around the public health risk.
Could you just tell us a bit more about the 2 to 4 strains that you mentioned? So obviously from Victoria there's one clear strain, but are there others? Could you just explain how that works?
So the virus has many different strains, and the virus has changed slightly, and so there is some, you can impute some where it's originated from. It has got some origins, it's changed, it's moved around, and the virus changes over time. So what we look for is the genetic code of the virus, and we can then see where, I suppose, the lineage, the family tree. And if anyone's seen it, it truly looks like a family tree. It's pretty scary looking at it. But what that helps us do is identify, and the question we've got for the Crossroads is, are we missing something else going on in southwestern Sydney? Or are these cases all the same strain and therefore representing the same source of introduction? And then we can be confident that we're not missing anything. So we look at the genetic sequencing, and at the moment we're progressively sequencing those strains. At the moment we're particularly interested in understanding for those cases where we haven't established a link. Because for us it's a question of, well, is that another introduction, or is that some locally acquired remnant virus that's been circulating in the community? So for us, our priority is going to be the few cases we haven't been able to link. And if they're linked to the Crossroads strain of the virus, that will give us confidence that what we've done is we've just missed an intermediary. Now, obviously, that means that there's a risk that there'll be other spread, but that's why personal actions can help us, because not all cases transmit. So if you've gone home, if you haven't then been out and about when you're infectious, then you may infect no one. But as we can see, if you are someone who's perhaps been in more social environments, having family gatherings, you've got a lot and you're infectious, you're going to potentially spread it to a larger number of people. And some individual cases have spread it to quite a number of people. There's variability. And that's why people, by adopting those behaviours of not having big family gatherings, of not going into large indoor environments, that good hand hygiene, not going out when you're sick, all of that plays its role. So we talk about the R effective, or how many on average one person infects. And if we can get that number down beneath 1, then this virus does not continue to grow. And that's our aim, and that's why people have a role in that, because the way people interact and the behaviours they adopt can help us modify that R effective, as can our contact tracing by having people get the disease, become infectious whilst they're actually isolating.
So Dr. Chant, at the moment, just on that, as it stands at the moment, you've got a man who inadvertently brought the virus over the border from the logistics company. Have you got other cases which you have worked out are definitely not linked to that transmission now, the current cases?
Not in the southwestern Sydney cluster, but remember we've got the cases from Albury that were also travel there. We had a case in Merimbula, and remember we've also mentioned yesterday that there was a case from Ballina. So in those cases we'll sequence it, and what we would expect is that if the predominant strain of virus that's circulating in Victoria is this, we might see some little variabilities, like some minor genetic changes, so it indicates that they've probably come from the same lineage, but they might have slight differences, and that's certainly what we've observed, minor differences between the viruses when we looked at the virus from the person from Sutherland, who also came up from Victoria, to the Crossroads strain.
Dr. Chant, there were reports this morning that New South Wales Health is planning on closing a number of clinics in the southwestern area. Can you comment on that?
I can confirm that the clinics in southwestern Sydney will be open, and I'd like to echo the Premier's appreciation for the staff in southwestern Sydney and the staff from some of the adjacent local health districts who have really stood up those clinics. Those clinics will remain open. I think the only one where there's going to be a variation in regard to the Stocklands Hotel, and that relates to the Crossroads Hotel, and that relates to the reopening of that hotel. So I think the clinic there will be operated on Saturday but won't be operating on Sunday. But please go to our website, and there's a large number of clinics, and also you can get testing through your GP and your primary health network will also have another list of where you can get testing.
Will there be a replacement clinic for the Crossroads Hotel drive-through, or will it just fall to the other clinics in that area?
There are some alternate sites being looked at as we speak, and we'll update the community. We'll release that information later in the day.
Just in regards to the Crossroads reopening, what do you say to people who want to go and have a drink there? Should they be a bit nervous?
Look, the Crossroads will have undergone deep cleaning. I think what's important is that we adopt COVID-safe ways of going about it. Clearly, they will be subject to the controls that have been put in by government, the additional controls, the safety marshals and others. And I think it's critical that we continue to understand the sorts of behaviours that we as individuals need to undertake, but also that business steps up and creates these safer ways of going about business.
Is there any message for parents going back to school on Monday in the southwest Sydney area?
I would just recommend everybody take the health advice, which is try and limit any of your social activity, be extra aware of symptoms, be extra aware of the sites. And I appreciate Dr. Chant was asked a question about businesses and how early they're informed. To be absolutely frank, our biggest issue is to make sure the public knows about these venues as soon as we do so that they can take action. If you've been somewhere where there's known cases, you need to immediately act. And I want to thank the health officials for not only liaising with those relevant businesses, but also making sure the public is aware as soon as we're aware of what's going on, because our first and foremost priority is to providing that information in real time to the public so the public understands and appreciates. And that's why we've been so overwhelmed with the testing that's happened as a result. In particular, I know we've thanked the health staff, but imagine those health staff that stayed back till 10 p.m. last Friday and 10 p.m. last Saturday night to make sure people were tested. I mean, this is going over and above what those requirements are, and I think it demonstrates how everybody is all hands on deck to get on top of this, all hands on deck to stop the spread. Everybody's doing their bit, and so that's why it makes us feel like we have to do our bit as well. And it doesn't matter where you live in New South Wales. The threat is there. The threat is as great in the regions as it is in Sydney. It's great here where we're standing as it is in southwest Sydney, because we just don't know whether there are those bubbling cases underneath the surface, which is why we've been extra vigilant. We're on high alert, and which is why we're reducing the risk. So if there is that bubbling away of community transmission, the indoor restrictions we've placed will limit the risk of major spread, and that is simply the phase we're in at the moment. It's about reducing the risk, about controlling the spread, and making sure that we keep communities and society moving forward. And I also want to thank those sporting organisations who will be undertaking their activities in a different way this weekend. Please limit spectators, please support the children in getting to the venue and picking them up. No mingling, no hanging around, no pretending life is back to normal, no handshakes and backslaps. I mean, sometimes when you look around and see people, the way people are acting, you'd think we're on a different planet. We are in a pandemic. We are not different from other parts of the world. We are not different from what's happening in Victoria. We are in the middle of a global pandemic. I think that's tautology, pandemic's global anyway, but we are in the middle of a pandemic and we all have to accept that. Life is not normal. It won't be normal till there's a vaccine, so please don't let down your guard. Complacency will cost lives. Complacency will stop us working and doing all those things we want to do. So please don't let your guard down, be complacent, and also call up your friends, as in call on your friends if you see them acting in a way which is too complacent. This is serious, and the only way we'll get through this is by being on our guard and assuming everybody in and around us has the virus.
Any instances of Victorians quarantining Northern New South Wales to get into Queensland?
I don't have any information on that, and I don't think we've got any clear evidence of that. But we also do have to assume that, unfortunately, there's always a small minority of people that think the rules don't belong to them, and we always have to be forever vigilant. And that's where I want to thank the New South Wales Police Force, everyone from the Commissioner down who is stepping up their activities. I know the instructions the Commissioner has given to members of the force is that compliance is key, whether it's a business, whether it's individuals, whether it's monitoring everybody's behaviour, and that will keep us safe. And I also want to thank the vigilance of Service New South Wales in supporting those efforts and getting information out. And of course, our health workers who've just been unbelievably heroic through all this and making sure that all of us stay safe. Last question.